let's dive into 10 essential tips that could make all the difference in your exams. Hey everyone, if you are gearing up for the NCLEX, you are in the right place. Today I am sharing 10 powerhouse tips to help you ace that test with confidence. Whether you are just starting your preparation or in the final step, these tips are designed to give you an edge. From strategies for handling tricky questions to insider secrets for staying calm under pressure, I have got you covered. Let's get started. Master the ABCs. Hey future nurses, let's talk about one of the most critical concepts you need for the NCLEX, the ABCs: airway, breathing and circulation. First up, airway. Always check if the airway is clear. If it is blocked, nothing else matters. No airway, no oxygen, so make it your top priority. Next, breathing. Ensure the patient is breathing adequately. Without proper ventilation, oxygen can't reach the tissues. Assess the rate, rhythm, and quality of breathing. Remember, your patient needs oxygen to survive. Lastly, circulation. After ensuring airway and breathing, check the circulation. That means monitoring pulse, blood pressure, and signs of perfusion. Without circulation, oxygen can't get into the organs that needed it. Remember, ABCs always come first. Master these, and you will be one step closer to passing your NCLEX. Here's a critical NCLEX rule to remember. When a patient is in distress, do not waste time assessing. Act immediately. If the patient is in obvious distress, focus on immediate interventions. The NCLEX loves to test this concept. Remember, there is no time for a full assessment when the patient's condition is critical. For instance, if a patient is gasping for air, you don't stop to assess the lung sound. You go straight to securing the airway. But here's the catch. If you get second-hand information from another healthcare provider, you can consider it. Just don't waste time reassessing the obvious. So remember, in distress situation, act first, assess later, unless someone else has already done it for you. Let's dive into a key NCLEX strategy: how to handle expected and unexpected findings in a disease process. First up, expected outcomes. When a patient condition aligns with what's typical for their disease process, your job is to monitor and then document. For example, if a patient with heart failure has mild shortness of breath, you document it and keep an eye on them. No surprises there. But if something unexpected happens, say that same heart failure patient suddenly has a crushing chest pain, that is where your nursing interventions come in. You need to act quickly and make a difference. After stabilizing the patient, call the healthcare provider immediately to report the change. Remember, expected outcomes, monitor and document, while unexpected outcomes, intervene and escalate. NCLEX survival tips. Stat words you need to know. Certain words scream urgency, like highest priority, most important, and immediate actions. Here's what they really mean. When you see highest priority, think life or death. You are looking for the action that, if missed, could result in severe harm or even death. Imagine you have a patient with severe chest pain and another patient with a mild headache. Which one gets your immediate attention? Exactly, the patient with chest pain. It's the most important because delaying could have a catastrophic results. And immediate action, it means there is zero time to waste. You need to do something right away or situation could get critical. Remember, for NCLEX questions with these stat words, always pick the option where failing to act could cause the most harm. That's your highest priority. Always start with the least invasive. When you are faced with the multiple interventions on the NCLEX, here is a key principle to remember. Always start with the least invasive option first. Let's say you have a patient with mild respiratory distress. You are given options like administering oxygen, repositioning the patient, or intubation. In this case, you would start with the repositioning the patient. It's the least invasive. If that doesn't work or help, Then you escalate. NCLEX questions love to test this. Start with what causes the least discomfort or risk to the patient, like non-invasive monitoring or simple comfort measures. So remember, when in doubt, always go for the least invasive option first. It's safer for your patient and often the correct answer is on the NCLEX. How to handle second-hand information. NCLEX tip that can save your points. When you receive second-hand information, your next move should always be to assess whether it's a lab result, an EKG reading, a report from the family, something in the EMR, or blood pressure reading from the machine. These all are the second-hand informations. These all are the second-hand sources. Your job is to confirm the accuracy by assessing the patient by yourself. Don't just rely on what you have been told or what the data says. For example, if a family member says the patient looked pale, assess their skin color by yourself. If an EKG flags a possible arrhythmias, check the patient pulse and symptoms. Remember, on the NCLEX, when you get second-hand information, the right answer is almost always to assess. And it's about ensuring accuracy and providing the best care. NCLEX tip: protect your patient's coping mechanism. Here's a crucial NCLEX concept. Never take away a patient's coping mechanism during a crisis unless it puts them or others at risk. Whether it's a deep breathing exercises, listening to music, or holding onto a comforting object. These coping mechanisms helps patient manage their stress during difficult times. For instance, if a patient is holding a rosary and praying to manage their anxiety, don't take it away. This ritual might be their way of staying calm. But here's the exception. If that mechanism is dangerous, like refusing necessary medication or physical harming themselves, you need to intervene. Your role is to ensure safety first. If the coping mechanism puts the patient or others at risk, that's when you need to step in. Remember, on the NCLEX and in practice, respect your patient's coping mechanisms and coping strategies unless they pose a threat. Your understanding can make a big difference in their care. Eliminate answer choices and DNR. Let's tackle a critical strategy for NCLEX questions involving DNR. Do not resuscitate others. When answering NCLEX questions, remember that DNR means the patient has chosen not to receive life-saving measures like CPR. Your job is to respect those wishes. For example, if you are given a question where one of the option is performing CPR on a patient with the valid DNR orders, you can eliminate these choices right away. Focus on options that align with the patient's wishes and provide comfort care, like administering pain relief or ensuring the patient is comfortable. The key is to identify and eliminate choices that contradict the DNR status. This will narrow down your options and guide you to the correct answer. Remember, when dealing with DNR orders on the NCLEX, always eliminate choices that go against the patient directives. Prioritize comfort and respect. Never withhold treatment. Here's a crucial NCLEX tip. When you are stuck between two choices, treat the patient or just observe. Always choose to treat the patient. Imagine you are faced with a patient showing signs of an infection. Your options are to administer antibiotics or to watch and wait. Which one should you choose? The answer: treat. On the NCLEX, it's better to act than to do nothing, especially when it comes to patient safety. When in doubt, remember this: treatment is proactive. It's about intervening to prevent a condition from worsening. Observation, on the other hand, can lead to delays in necessary care. So, when you have to choose between taking action or doing nothing, always pick treatment. It's the safe bet for your patient. NCLEX red flag: reversals from the norm. Here's a vital NCLEX tip. If you notice a reversal from the norm, it's a sign to worry and take action. For example, let's talk about rebound tenderness. That's when a patient feels pain after you release pressure on the abdomen. Normally, releasing pressure should relieve pain, but in this case, opposite happens. That's a serious red flag. When something that should make things better actually makes them worse, it's time to act. That is your cue that something could be seriously wrong. Think of other reversals like a patient blood pressure suddenly dropping after being stable, or mental status deteriorating after initial improvement. These all are signs that demand your immediate attention. So remember, if you spot a reversal from the norm, don't hesitate. Worry and take actions right away. It could make all the difference in your patient's outcome. These strategies can make a huge difference on your preparation and success. I hope you found these tips helpful and more confident about upcoming exam. If you want even more tips and tricks, let me know. Drop a comment below if you are having interest in part 2, or if you have any specific topics you would like to cover. Your feedback helps me to create a content that's more useful for you. Don't forget to like, subscribe and hit the notification bell so that you never miss an update. Good luck with your studies